Hello, my name is Megan Folkerth, and I'm a Senior Program Officer with Interact for Health on the tobacco team. I'm joined today by Community Outreach Officer Julian Collins, and we're excited to share two funding opportunities with you. First, I'm going to give you some background on Interact for Health and our tobacco strategy. Then Julian will share the details of the Innovation to Reduce Tobacco Disparities RFP, and I will wrap up with details on the impact of COVID-19 pandemic on tobacco use RFP. Interact for Health promotes health equity to improve the health of all people in our region. We serve 20 counties around Cincinnati in Ohio, Kentucky, and Indiana. We improve health through grants, education, research, policy, and engagement. To amplify the impact of our work, Interact for Health focuses on three strategic priorities: reducing tobacco use, addressing the opioid epidemic, and ensuring that children have access to health care through school-based health centers. In 2018, Interact for Health prioritized reducing tobacco use as one of our strategies. At that time, we launched the Greater Cincinnati Adult Tobacco Survey to gather baseline data to inform our strategies and our work. Despite progress, Greater Cincinnati continues to lag behind the nation. You'll see here that in 2018, the percentage of adults who were current smokers in Greater Cincinnati was 19% compared to the nation at 14%. If the percentage of Greater Cincinnati adults who smoke was similar to the nation, our region would have 90,000 fewer smokers. Using this data as well as best practices and lessons learned from others in the field, we embarked on our strategic plan. We set an aspirational target at a 15% reduction. This would take our smoking rate from our baseline of 19% to a target of 16%, with the majority of the reduction coming from people with lower incomes. Here you can see the strategies within our tobacco focus area. When we initially started in 2018, we had three strategies: tobacco policy change, innovation to reduce tobacco-related disparities, and marketing and community relations efforts. We have made progress in each of these strategies as well as had challenges, many due to the COVID-19 pandemic. A little later in the presentation, I'll share some tobacco use data that we collected during 2020 that has led to the addition of the fourth strategy that you see here, which is the impact of COVID-19 pandemic on tobacco use. Now we're going to dive into our current funding opportunities. Here you'll see our eligibility criteria. In order to apply for the funding opportunities, an entity must be a public or private nonprofit or governmental organization and provide services in at least one county of Interact for Health's 20-county service area that you see here. The timeline for funding for both of these opportunities is the same. The funding webinar is available when these release on June 22nd. The letter of intent deadline is 5 p.m. on July 9th. We will notify people of acceptance of letters of intent on July 16th. The full proposals will then be due by 5 p.m. on August 13th. At that time, we'll review them and we will set up site visits between August 16th and 25th and notify awardees of their grants by September 10th, 2021. The link that you see here will navigate you to a page where you can find all of the RFP overview documents, the LOI questions, the proposal questions, as well as a link to our grant portal. And then also to note, once we award grantees, we sign contracts, we will do grantee onboarding October 6th and 7th, and we will send those specific times to you at the time of notification. In order to submit grants, you will use our online portal. That is the first link here. If you have received a grant from us in the past few years, you're likely to already have an account. You may have already accessed our system. If that's the case, you'll just log in using your current information. If you've had a grant but haven't in the past couple of years but haven't used our online system, you can use the forgot password link, or you can reach out to our grants manager, Christine Schultz, for additional information. The second link that you see on this slide is a link to a pre-recorded video that was done earlier this year that will give you tips on navigating our online system, walk you through that process of forgetting your password and getting logged in. So that's a great place to start. And then again, Christine Schultz's information is listed on this page, and you'll be able to reach out to her and get additional help. Now I'm going to turn it over to Julian to discuss the Innovation to Reduce Tobacco Disparities RFP.
Thank you so much, Megan. We are very excited to tell you a little bit about our Innovation to Reduce Tobacco Disparities RFP, which is a re-release with some revisions made. Next slide. Next. Yeah. We are making progress, but there's still an issue. We are not seeing progress amongst all people. Here, smoking is concentrated among people living with lower incomes, as we can see here by this graph from our adult tobacco survey. We can see here that those who are living in poverty have higher rates of smoking than those who are living just below the poverty level, as well as those who have higher incomes. And what we know that can be behind this is the amount of retailers in an area called tobacco retailer density. We find that there are more dense pockets of retailers in places where people have lower incomes compared to higher income neighborhoods. Also, there is a lot of marketing to those living in lower incomes, and you do find that there are a lot of ads as well as colors and promotions being placed in lower income communities. We see more point of sale discounts in these neighborhoods, as well as there is limited access to cessation services for people living with lower incomes. Menthol cigarettes are used by majority of African American smokers. Though we know that African Americans and white people in our community smoke at around the same rate, African American smokers smoke 68% of current menthol cigarette sales. We know that this is, there are some reasons behind this, including community culture. This really has been ingrained. Starting around World War II, we start seeing that tobacco industry really start focusing on making the menthol cigarette products a product for the African American community. This is the only remaining flavor in cigarettes at this time, with most other flavors being banned in 2009. One thing we do know is that they are easier to start due to the menthol flavor, which acts as an anesthetic in your system. So it makes it softer to smoke and without some of the harshness. But it also, because of this, makes it harder to quit. In our rural Kentucky counties, we see that they have the highest percentage of adult smokers. As we can see here, especially in our lower counties of our region, including Gallatin, Carroll, Owen, Pendleton, and Bracken, which has that 32% rate of adult smokers. Some of the reasoning behind this is the lack of smoke-free policy in these locations. There's a history of tobacco growth through tobacco farming in these areas, and as well as the tobacco industry has really been deeply rooted in the politics in these areas, since it is a large crop and a large economic booster for those communities. Now that we are expanding our populations, we also want to look at adults living with substance use disorder. As we can see here from this chart from the Substance Abuse and Mental Health Services Administration, those adults who smoke have a higher rate of using other controlled substances such as heroin, cocaine, hallucinogens, compared to those who don't smoke. And what we do know is that cigarette smoking increases the likelihood of relapse among people in recovery from substance use disorder, as well as studies have linked nicotine exposure to cravings for stimulants and opiates. And then looking at the LGBTQ plus community, especially at the adults, we do know that 2.5% adults who identify as lesbian, gay, bisexual are 2.5 times more likely to smoke than those who identify as straight. If we look at the actual numbers, we know that straight adults smoke at a rate of around 14.9%. Those who identify as lesbian, gay, or bisexual smoke at a rate of around 20.6%, and transgender adults smoke at a rate of around 35.5%. Behind this, we know that there is a history of predatory marketing by the tobacco industry amongst the LGBTQ plus community, especially at events focused on Pride as well as HIV prevention events. And there is an increased stressors of those who identify as LGBTQ, which leads to them looking for that stress relief through the use of tobacco. For this, our RFP goal here is to pilot and spread promising programs and practices to reduce tobacco-related disparities. Looking at the RFP overview, we are allowing for the planning and implementation of community-led piloted projects focused on reducing tobacco-related disparities amongst adults living with lower incomes, African American adults, adults living with substance use disorder, adults who identify as LGBTQ+, and people living in lower incomes. We know that a lot of times, historically, these communities have sometimes been overlooked when it came to cessation efforts, or cessation efforts have been brought in that were not culturally appropriate and specific for these communities and have not always been fully utilized. So this is a chance to try something different, getting that community input to make sure that there is a solution for the people who live there. Next slide. For this, the funding that we have available is up to $500,000 for these efforts in 2021. For those who are interested in planning, these will be smaller grants up to around $35,000, and this is a short-term process of 6 months or less. In order to be considered for future implementation funds, final plans must be submitted on or before April 15, 2022. And this is so that we can make sure that you have the opportunity to apply for larger funds if you're looking to implement a larger project. The implementation grants, these are for those who kind of have that idea and are ready to go. These are larger projects, so up to $100,000, and they are for a longer term of 12 to 18 months. And understand that funding length will differ and vary depending on the proposed activities and plans. And the request must be right size for the community and the work proposed. Looking at some of the planning activities a person could kind of be interested in. This includes research and information gathering, establishing relationships, engaging community members as part of the planning process, data collection, and developing an implementation plan with budget. As part of the final plan that you will come up with, the biggest thing that we will want to see is that implementation plan with the budget before we can talk about the ideas of implementation funds. Looking at our implementation activities, we are looking for those evidence-based strategies that previously have not been used with this population, as well as new innovative approaches. This is really enacting a project or a program in a location. And we do know that we are working with new populations here. So let's say that you are looking to establish something within an organization. It can be for not only the communities that you will be serving, but also for staff to make sure that there's that staff involvement as well. To start with, as we talked about, as we looked at the timeline, the letter of intent. These are the questions that will be involved as part of that letter of intent, including the statement of problem, opportunity, or need, like why is this important in this area? We would like to know a little bit more about the key disparities and in addressing those disparities. So what population will you be focusing on, and how are you addressing this, and how are you including them in the process to address this? We want to know a little bit about your proposed project, but we do ask that you keep this part brief, because if you are invited for a full proposal, you'll be given a chance to expound a little bit more on what your proposed project is. We want to know a little bit more about the number of people you might reach, your geographical area, so what neighborhood, what community, what county will you be focusing on? How long will you need for this project? Kind of give us an idea of what your overall grant goal will be, like what are you trying to reach with this, as well as the amount needed to complete this project. For those invited to full proposal, you will have your LOI questions, which will then be transferred automatically. So your responses will be automatically transferred, but you will have the opportunity to edit and update as needed. And the proposed project has additional directions for you to expand upon your answer. So this is where you'll be able to really give us a lot more detail on your proposed project. To that, we've added some additional questions in the full proposal, including more information on the lead organization, the population of focus. We want to really understand and have a good idea of how you plan to engage the community, how you will serve people with disabilities, if you have any collaborators with this project, and then of course we will want to know a little bit about your anticipated start time, and as well as your grant objectives and outcomes. And when you look at the instructions for the form, there are examples if you do have any questions around that. We would also like to know if for this project you have any other funding sources, and have you already thought about your anticipated sustainability plan once the funding for this project is ended from us. For the budget, the grant funds may be used for all activities related to the proposed project. Funds may not be used for lobbying activities. You would need to download the budget request form in the online system and complete one form per year of funding requested. And if you have any questions, please feel free to reach out around this budget request form. So additional required materials from the lead organization, we will need your current operating budget, audited financial statement if available, list of board of trustees, and disclosure forms, which are available to be downloaded or which will be downloaded in our online system. As well as we will need a concluding statement from the executive director or the CEO, just so that they will know what is going on, that they are on board and approve of you going forward with this project. For the grantee requirements, part of the project in which you will agree to is attend grantee meetings, as well as technical assistance sessions periodically. Working with Interact for Health to develop a community plan. This is especially for planning grantees. Working with Interact for Health to develop an evaluation plan. This is for our implementation grantees so that we can figure out how to evaluate the success of the project. And participate in activities as part of the overall evaluation of the initiative. As we look at the selection criteria to kind of give you an idea of what we're looking for, we really want to see that you are addressing and reducing tobacco disparities among one of the priority populations identified in the RFP. But we do ask that you give us a realistic timeline. We understand that we all have wonderful, great goals, but we also know that we need to be realistic and be able to shift when necessary. So those are some of the things we are looking to see. Having a clear delineated budget with justifications, having staff and capacity to lead the proposed project. We definitely want to make sure that you are not overburdening yourself as an organization with this project, including matching or in-kind contributions, and demonstrate flexibility with proposed delivery methods. As we've seen with the COVID pandemic, sometimes we need to make shifts, and we want to make sure that that is still possible with this project. So looking at some of the tips and hints as you are trying to apply for one of our RFP proposals, we want to know that we know that tobacco is an issue. So be as specific as possible about your population or community. You don't have to give us the basic elementary information, kind of looking at a large macro area. We really want to see what's going on with the community of focus that you are really planning to deal with. Avoid using jargon or acronyms, just so that we can all be on the same playing field on what you're talking about. Be realistic with your timeline and anticipated objectives, And please feel free to reach out with questions. We want to definitely help you every step of the way as you're going through this process. So for proposal submissions, the letter of intent should be submitted no later than 5 p.m. on July 9th, 2021. And if invited, the full proposal will be submitted no later than 5 p.m. on August 13th, 2021. The RFP information and application questions can be found at the link below. And you will submit the application and required materials via the online grants management portal, which is found at the link below, but also you can easily find it on our website under funding opportunities. Now, if you have any questions throughout this process, or even as you're going through this and have some questions or have an idea that you just kind of want somebody to have a quick look at, please feel to reach out to us. I am Julian Collins. My email as well as phone number is available there. We are more than happy to help you through this process, especially we are wanting to see great projects and work happening in our area. So please feel free to reach out.
Great. Thanks, Julian. Now I'm going to walk you through the second RFP that we have available. This one is called The Impact of COVID-19 Pandemic on Tobacco Use. So this relates to that fourth strategy that I shared that we added this year due to what we've seen COVID-19 has done to our community. So I'm going to walk you through some of the data that gives a little bit of the justification for why we added this RFP, and then I'll dig into the requirements to apply for funding. During the COVID-19 pandemic, progress on reducing tobacco use stalled on all fronts. In the fall of 2020, we conducted the Greater Cincinnati COVID-19 Health Issues Survey to understand adult behaviors, attitudes, and opinions related to the COVID-19 pandemic. If you recall from the earlier data that I shared and what you see here on the left side of your screen, our baseline data in 2018 showed that 19% of Greater Cincinnati adults were current cigarette smokers. Despite years of steady declines, when we surveyed again in 2020, we saw that 21% of Greater Cincinnati adults were current smokers. While this is not statistically different than our baseline, it certainly isn't a decrease and speaks to that stalling that we've seen. So what's behind this stall? We learned that since the start of the pandemic in 2020, that 23% of current adult smokers in the region reported smoking cigarettes more frequently, and 9% of current adult smokers started to smoke again after having previously quit. While this is not unexpected considering the incredible physical and mental stress and economic toll that the pandemic has taken on so many people, it's still disheartening to confirm with our local data that this is what we're seeing in our community. Other data that complements our hypotheses are national tobacco sales trends. From April to June of 2020, early on during the pandemic, national tobacco sales increased by 13%, particularly for many of the demographic groups that you see here. Looking at tobacco sales by year, they'd remained relatively the same until 2020, when we saw that increase from $3.12 billion to $3.53 billion during this time frame in 2020. In addition to that, we also have looked at the impact of the pandemic on smoking cessation. The data you see here looks at call volume to state quit lines by year. The 2020 call volume was the lowest since 2007. Calls to state quit lines decreased by 27% in 2020 compared to 2019. The decreases were not uniform over 2020. If you break it down by quarter, the decrease actually mirrored the timeline of the pandemic. So there was a 6% decrease in the first quarter of 2020, followed by decreases of 39%, 30%, and 21% in the following quarters. So this data indicates to us that the pandemic has had a negative impact on smoking cessation while we saw increases in tobacco sales. The 2020 national tobacco youth tobacco survey was collected between January and March of 2020, so it unfortunately does not take into account the pandemic. However, we do still want to address youth tobacco use through this RFP. The data did show a decline in youth e-cigarette use from its peak in 2019. It found that 19.6% of high school and 4.7% of middle school students reported current e-cigarette use. While this is a decline in use, these numbers still mean that 3.6 million U.S. youth were current e-cigarette users in 2020. So that's still a very staggering number and still something that we needed to address. This data is pulled from our Greater Cincinnati Adult Tobacco Survey and aligns with some of the information we showed you earlier. And this just makes that connection of, I just showed you youth e-cigarette data. Those youth obviously grow up to be adults. And while this was collected pre-pandemic, it still shows what we're dealing with in our community. So you'll see here 36% of 18 to 29-year-olds in our region are current e-cigarette users. And we know that 91% of them report that their product usually contains a flavor. Now, what we do have that shows the impact of the pandemic, we don't have that youth e-cigarette data yet, but we have national e-cigarette sales during that time. So you can see here the label in March 2020, when the COVID-19 pandemic started, you can see that sales were at 15.4 million. Now you can start to see it kind of leveled off a little bit, and then you really start to see an increase in October of 2020. So from September 2020 to March 2021, e-cigarette sales actually increased by 32%. So you can see maybe early on people were decreasing their use a little bit, using the same, but then as the pandemic continued, we started to see that increase. So while we don't have data showing us youth e-cigarette use has increased necessarily, we have to wait until this fall to see what the 2021 numbers look like. We do know that our sales are continuing to increase. So we've taken all of this data, all of this information that we have, and decided that we needed to add a funding opportunity so that we can begin to address this. So the goal of this RFP is to implement programs to promote cessation in response to increased tobacco use and relapse due to the COVID-19 pandemic. This funding will focus on the implementation of programs that are focused on decreasing tobacco use for both adults and youth in the region. So the problem is now. We don't feel like we have time to go through the planning process. We certainly value planning, as you will see it's part of the RFP that Julian just walked through. However, we need to address the stalled rates and the increase in relapse now. And so we're looking for projects that are ready to go, ready to hit the ground with implementation now, that focus on increasing those cessation attempts and use evidence-informed cessation strategies and tactics. So like Julian shared in the innovation RFP, we're looking to do things differently there. We're looking for maybe new programs or programs that have never been tried with a population before, and that funding is a little bit riskier in that we're willing to take those chances. With this, we're looking for more of those tried and true programs and strategies that we know work, that we can deploy in the community quickly. Some project examples for this RFP would be if you have a cessation program already in your community, but you need to increase delivery of that. And so you need additional dollars so that you can offer that more frequently in the community. Maybe there is a best practice or an evidence-informed strategy out there for cessation that you've wanted to bring to the community, but you don't have the resources to. So you could be implementing a new program in your community. This can also include incentives to encourage quit attempts among tobacco users. And then we're also interested in tobacco cessation marketing efforts. We would want to make sure these are tailored to specific audiences, not necessarily one-size-fits-all campaigns, but how do you narrow in on a specific population within your community? And then the campaign should already use developed materials. Development of campaign materials can take a very long time. And so again, since we're looking for things that are ready to go now, we would want to use campaigns that are already developed that you can deploy in the community. For this funding, we have up to $300,000 available in 2021, with the hope that we will also release this funding again in 2022. These are implementation-only grants. We anticipate that these will be 12 to 18 months in length and up to $75,000. Again, the funding length and amount depends on the proposed activities and plans, and they must be right-sized for the community. So certainly, if you need to have a conversation about this, reach out. We can talk about the funding amount. We want to know what you need. We just need to make sure it's right-sized for the community. Again, there's a letter of intent with this, as we discussed the timeline at the beginning, and here you'll see those questions that we're asking at the letter of intent phase. This really is a subset of questions. We just want to get an understanding of what your project is. So prior to using our online grants management system, we would have asked for 2 pages of narrative on what you were going to do with your project. So kind of keep that in your mind as the amount of information that we need. So we're looking for what the problem is in your community. Again, localize it. What information do you know specific about your community? We just shared a lot of the national problem with you, the regional problem. You don't need to reiterate that information to us. Are there any key disparities that you're going to address? And then what do you want to do? What are those activities? How many people do you anticipate reaching? In what community are you doing this? And then what is the length and the amount of money that you need to do this project? And then we do ask what that overall grant goal is. That's just a easy, short snippet way for us to understand what you're hoping to achieve, what success looks like to you. If you are invited for full proposal, those letter of intent questions will automatically transfer over with your responses. You can certainly edit and update those as needed. As we review full proposals, we'll look at those responses again. And the proposed project will have some additional directions where we would like you to expand upon your answer. So at the letter of intent stage, we would ask you to be brief, and then we will give you additional prompts to give us more information at that full proposal stage. And then on the right-hand side, you can see the additional questions that are added. So we'll gather a lot more information about the organization that's applying, such as your commitment to equity, your service area, what your budget looks like, how many people you serve, how many staff members you have. This is where if you are not a nonprofit organization, maybe you're a coalition that doesn't have your nonprofit status and you're using a fiscal sponsor, you would indicate that fiscal sponsorship at this stage and provide that fiscal sponsorship information. We also will expand upon your population of focus, how you're going to engage members of that community. Are you serving anyone with disabilities in this? Are you collaborating with other organizations? Is it a group of organizations that are coming together, or are there other people at the table? And then we'll get a little bit more detailed in when you want to start the project and expand upon that goal that we ask at LOI stage. What then are those objectives and outcomes that you're hoping to achieve? And then wrap up with any other funding sources that you have and what sustainability looks like post-funding. As Julian shared, the grant funds for the budget may be used for all activities related to the proposed project. Oftentimes we get asked, can it be used for food, incentives? Yes, they can be used for all of those things. Really, the biggest restriction here is that funds may not be used for lobbying activities. These funds aren't policy-related efforts anyways, and so that shouldn't apply, but we always like to say that our funds cannot be used for lobbying. So you'll download the budget request form in the online system, and you'll complete one form per year of funding. So if you're asking for 1 year of funding, you'll just complete one budget form. It'll ask you about any additional revenue you have and then what those expenses are that you're asking us to pay for. And then the second page will have a budget narrative where you can explain a little bit more in detail about what you're requesting. If you're doing an 18-month project, you would do 2 budget forms, one for the first year and one for the second 6 months. Additional required materials that you'll upload to the system will be the current operating budget of your organization. If you have audited financial statements available, not everyone has those, but if you do, there's a spot to upload those. Your board members, and then a disclosure form. You'll download that in our online system, complete it, and re-upload it. And then finally, just that concluding statement from the executive director or CEO showing their support for the project and knowledge of the project that's being submitted. If you are awarded grants, the grantee requirements are attend grantee meetings as they're planned. Likely there will be an onboarding meeting and maybe one throughout the duration of the funding. These are really intended for you all to meet each other, those that are awarded, share successes, lessons learned, challenges throughout the timeline of the project so that you can learn from one another and build those relationships. Work with Interact for Health to develop an evaluation plan. Since this is implementation, there will be an evaluation plan, but our evaluation team is wonderful and will work on this process with you so that we get a solid evaluation plan that we can talk about success at the end of this project. And then participate in any activities as part of the overall evaluation. So we'll look at these grant awards as a collective body of work, and we would ask for your participation in that. When we are selecting projects to fund, the most important is that this addresses the impact of the COVID-19 pandemic on adult or youth tobacco use, that you're using evidence-informed tobacco cessation strategies. Again, if this is a new project as far as something that's never been tried before, something really innovative addressing disparities, we would want you to apply in the RFP that Julian talked about, our innovation funding, versus something that's already evidence informed would fall into this category. We want to see engagement of community members, a realistic timeline and budget, making sure that organizations have the staffing and capacity to lead the proposed project, and then any matching or in-kind contributions from the organization or other partners. Some tips or hints. Similar to what Julian shared, we know tobacco is an issue. It is one of our strategic priorities. You certainly don't have to sell us on that. So when you're sharing data, try and share data that's very specific to your community or population that you're addressing. Avoid those jargon and acronyms. There's a lot out there. We know some of them, but we certainly don't know all of them. And so it's easier if we just avoid those for everyone. Be realistic with the timeline and anticipated objectives. I think a lot of times we tend to think that we can accomplish things a lot quicker than maybe time takes, or that we are very optimistic, which is wonderful, but we ask that you be realistic. We'd rather know what that looks like up front versus having to go on the back end and add time or change expectations. So be realistic. It's also, we're still in the midst of the COVID-19 pandemic. Things are starting to open up, but they're not fully. So think through that as you're putting together your plan, and certainly reach out with any questions in the process. We're happy to talk through proposal ideas before you submit them and provide any feedback or insight on those prior to that deadline. So just as a reminder of the deadlines that we do have, the letter of intent would be submitted no later than 5 p.m. on July 9th. We will notify you by July 16th. If you're being moved on to full proposal stage, we'll notify everyone whether they're moving forward or not. The full proposal, if invited, would be due on August the 13th by 5 p.m. And then once we review those, at the application, you'll also put in site visit times that you would be available, and we'll conduct site visits between August 16th and 25th. We can have those conversations if those are virtual or in person, what works best for folks. We're happy to accommodate. You'll see lots of times when you fill all that out of what works best for you, and we'll get those scheduled, and that really just is a time to dig a little bit more into the project, ask any questions that we have, and get a full picture of the project before we make our funding decisions. The RFP information can be found at the first link you see here. This webinar will be posted there along with the RFP overview, the LOI questions, and the application questions, so you can download those and see what those look like ahead of submitting an application, and then everything will be submitted through our online grants management system. And I would just refer you to earlier in the presentation when we shared a link that gives you tips on navigating that online system, as well as then a link to the system and Christine, our grants manager's contact information, and she's certainly happy to help with any problems or challenges that you're encountering. And as you're working through this, considering funding, starting to apply, please feel free to reach out to me with questions. You'll see here my cell phone number as well as my email. Happy to work through those with you. So I'll be the point of contact for the COVID-19 funding opportunity, and Julian will be the contact for the innovation funding. And we're certainly happy to both answer questions for you. We thank you for taking the time to listen to the presentation today, and we look forward to connecting with you and reading proposals. Thank you so much.